understanding and managing morning sickness. Hey everyone, and welcome to Healthiatric. Today, we're diving into a topic that affects a huge number of pregnant women, morning sickness. Now, despite the name, it doesn't just happen in the morning, does it? It's more like any time of day sickness, and if you've experienced it, you know exactly what I'm talking about. Pregnancy is an incredible journey, a miracle of life. But let's be real, it can also come with some not-so-pleasant side effects. Morning sickness, with its nausea and vomiting, is one of the most common. In fact, studies show that over 50% of pregnant women experience it. So, if you're feeling queasy, you're definitely not alone. So, what exactly is morning sickness? Well, it's that lovely combination of nausea and vomiting that often hits during the first trimester. It usually starts around 2 weeks after conception. And while an empty stomach can be a trigger, it can strike at any time of the day. Now, the severity varies. Some women experience mild nausea, while others struggle with intense vomiting. It's not a one-size-fits-all experience. Interestingly, women who are prone to migraines or motion sickness might be more susceptible to morning sickness. The million-dollar question: what causes it? Well, there isn't one single answer. Doctors believe that the dramatic hormonal changes during pregnancy are a major culprit. These hormonal shifts can affect the digestive system, leading to increased acid production. It's like your body is going through a major renovation, and sometimes, things get a little messy. Other factors can make it worse, like stress, exhaustion, and even certain foods or smells. It's like your body is suddenly super sensitive to everything. The most common symptoms are, of course, nausea and vomiting. But there are other signs to watch out for. These can include increased salivation, sensitivity to odors, and sometimes, these symptoms can appear out of nowhere. Now, most of the time, morning sickness is just an unpleasant part of pregnancy. But there are times when you need to contact your doctor. If you experience intense nausea and vomiting, dark-colored urine, an inability to keep down fluids, a rapid heartbeat, or dizziness, it's time to seek medical help. So, who's more likely to experience morning sickness? Well, if you've had motion sickness, migraines, or a heightened sensitivity to smells or tastes before pregnancy, you might be at a higher risk. Also, if you're expecting twins or multiples, or if you had morning sickness in a previous pregnancy, your chances increase. And then there's Hyperemmesis Gravidorum, a severe form of morning sickness. This can lead to dehydration and significant weight loss, requiring hospitalization. Interestingly, women expecting a girl or with a family history of Hyperemmesis Gravidorum are more prone to this condition. Okay, let's talk about solutions. There's no magic cure, but there are ways to manage the symptoms. Doctors often recommend vitamin B6 and doxylamine, which are available over the counter. There's also a prescription medication called diclegis, which combines both. For more severe cases, antiemetics, antihistamines, and anticholinergics might be prescribed. But medication isn't the only answer. Dietary changes can make a big difference. Try eating smaller, more frequent meals. Avoid fatty and spicy foods, and opt for bland options like bananas, rice, and toast. Healthy snacks like peanut butter, yogurt, and fruit can also help. And most importantly, stay hydrated. Some other tips include taking prenatal vitamins with snacks, avoiding strong odors, and having ginger tea. And while some women turn to marijuana, it's crucial to consult your doctor first, as it can be harmful to both you and your baby. Beyond diet and medication, there are some simple home remedies that can help. Get plenty of rest, avoid sudden movements, and try sucking on ice cubes. Wear loose clothing, stay active, and avoid fried foods. Remember, moderate morning sickness is generally not harmful to you or your baby. However, severe cases can lead to dehydration and malnutrition, which can affect your baby's birth weight. So, it's important to take action and manage your symptoms. Morning sickness is a common experience for many pregnant women. It can be tough, but it's usually temporary. By understanding the causes, symptoms, and treatment options, you can navigate this phase with more confidence. Remember, you're not alone, and there are ways to feel better. Thanks for watching Healthiatric and stay healthy.